Hello, this is Tiffany Roberts. Thank you so much for joining me on this short video as we discuss what functional and lifestyle medicine is. This is probably a question that we get asked on a daily basis next to, why did my doctor tell me this or refer me to this route of medicine? The first question we have for our patients is, are you looking for a smarter approach to your health? Because this is what we feel functional medicine and lifestyle medicine provides. It provides a strategic yet smarter and more cost-effective approach to what the current healthcare model has to offer. Many of our patients come into our office asking us these very questions. How can I improve communication? How can I improve my diet? How can I manage my stress? Why do I respond the way that I do? Why do I feel anxious and depressed? Where can I get the time to make the healthy dietary changes and lifestyle modifications? How can I be a better person? Because at the end of the day, that's really what we are all looking for, is how we can become better than we were yesterday, or how can we be better at what we do on a daily basis. We truly feel that our health is the foundation, to become a healthy person and contribute to a healthier cause in the community, but also with our family. Someone smart once said, the doctor of the future will give no medicines, but will interest his patients in the care of the human frame, in diet, and the causes of prevention of disease. This person was Thomas Edison. He said this about 100 years ago. But what's amazing about this quote is when we really look at the state of affairs of our healthcare system, it's actually moving further and further away from this. We are introducing more medications and more surgeries. Doctors are spending less time with the patients, educating them about diet, and less time being spent on how to prevent diseases, and more time is being spent on treating them. What we tell our patients is, imagine every specialist would only spend 80% of their time teaching the public how to prevent disease instead of 100% of time treating preventable diseases. You were born with the keys of a Ferrari. The problem is, no one has taught you how to drive it. In our current system, instead of making the driver responsible and putting the driver in the right position to make better choices and execute better, what it does instead is blame the car. It blames the vehicle. It blames the body for making mistakes when in fact your body doesn't make mistakes. So it is important for you to understand that you are ultimately responsible for your health, and no one will take that responsibility into their own hands for you. When we compare traditional medicine to functional medicine or any holistic form of medicine, we like to compare apples to apples and oranges to oranges. Our current healthcare system is set up like a firefighter. His job is going in to put out the fire, and you'll be grateful that he did at the end of the day. But when he's done with his job, your house is worse off than it was when it started. So the idea here is we want to have a repairman who are available to help us build the house back up, and perhaps helps find a way, the reason why the house burnt down in the first place, and teach us what we can do about it. There is certainly a need for allopathic medicine for emergency interventions, but unfortunately, this type of care is very costly and destructive to your body, and at the same time, it doesn't put you in the right position to take ownership for the problems. Simply giving you drugs and cutting up your body parts doesn't fix the underlying cause. It might be a short-term solution or even a long-term solution, but it It certainly doesn't address the root cause of the problem. And this is why some people might require ongoing medications, ongoing monitoring, and ongoing treatment. We will quickly talk about epigenetics because this is very influential on how genes express themselves. Epigenetics are influenced by three main things: what you eat, what is the information from the food that your body is receiving, how you move, which is your exercise and your movement patterns, and the way you think. These three things, how you eat, move, and think, ultimately influence the way your genes express themselves. And in doing so, will express a state of health or a state of illness. When you can influence these three factors, which are totally in your control, you can have much more positive outcomes. You don't have to become your parents. You have full control over these genetic representations. In fact, 75% of your genes are controlled by these three factors, which means you are in full control of how your genes express themselves. And these are modifiable inputs. So it's time for a smarter approach. And just to give you a simple illustration, in functional medicine, instead of looking at what boils up to the surface, which is the issue at the very top of the picture, these are things like heart disease, depression, and diabetes, which is a diagnosis code. Instead, what we look at is the root cause of the problem. Is the problem coming from inflammatory issues? Is it because you're not eating the right things? Is it because you're not getting enough sleep? Are you nutrient deficient, as most of us are? Is it the way that you're thinking? Is it trauma? All of these things you see under the surface, all of these things add up. And we as clinicians look for and try to address these things because you can control these things, and these things will ultimately affect the outcome that you see on the surface. Functional medicine essentially understands the body and how it does not work in isolation, but instead, like these series of gears that all work synergistically. And unfortunately, medicine has done a great job of separating and specializing doctors so that each doctor may look at you through a microscope and the lens that only they understand, and it ignores the rest of the field of vision. So our job is to come in and look at the whole picture and identify where the problems are really coming from. For more information, you can go to our website and learn about how we can help you. I'm just going to go give you a quick overview of how our program is different and what you can expect when you come in. Working with you, you will receive one-on-one care. We have a team of providers that work with us who will also work with you in your care if necessary to determine what is the best approach. Each of your appointments are set up based on half-hour blocks, and therefore there is adequate time for you to go over questions and your concerns. You will also receive access to the doctor, and he is able to answer any questions that you have through text, email, or even calling outside of your scheduled appointment. You get a very personalized level of care with us. We feel that it is a smarter approach. We provide lifestyle education, which is long-term self-care strategies, direct access to the clinicians, and each patient receives a personalized solution, which means that the protocol we use for you is going to be unique for you, not to your disease or your diagnosis. We start with the assessment and history, which is critical in identifying where the underlying problems are coming from. Our intake form is probably one of the most comprehensive forms that you'll ever fill out. and it guides us through where the problems are. Based on testing that we determine, we can identify and any dietary changes that you need to make, what nutraceutical changes that you need to make or introduce so that you can have a much better outcome at the cellular level. During our care, you will also receive lifestyle education so that you can understand better how the body works. We will teach you simple truths about how you can utilize your body as a tool for better healing, an ideal response to treatment. Instead of feeling like you have a lack of responsibility, you're going to feel fully in charge when you're with our program. We have a strategic checkpoints. You want to make sure that what we are doing is working. So therefore, what we will do is that we will meet with you on a regular basis, but also test you periodically to identify if the markers we are wanting to shift have shifted in the right direction. And if those changes, where we can request you to make different changes if we need to, also being applied to your daily routine. As a part of our commitment to ensuring your education and lasting success, we also provide ongoing care through continued education. Along with this online access to your education, we are committed to providing presentations each month for the furthered educational experience. The conditions that we can help and address in our practice include things like ADD, ADHD, food sensitivities, adrenal fatigue, Crohn's disease, cancer recovery, digestive health, thyroid issues, leaky gut syndrome, hormonal health, you name it, we can do it. When we work with our patients, our main function is to focus on them from the comprehensive standpoint and then create a strategy to basically tackle any chronic condition that you may be faced with. Once again, I encourage you to visit our website at www.functionalmedicinekc.com. Spend a few minutes on there and learn about the conditions that we can address. Thank you so much for watching this short video, and I look forward to working with you in the future.